Good evening, everyone. My name is Nirvik, and today I will be presenting about a very concerning topic of antimicrobial resistance and its solutions. Before we begin, I would like to acknowledge the traditional custodians of the land on which we meet today, the Tharawal people of the Tharawal Nation. I pay my respect to elders, past and present, and extend the respect to all Aboriginal and Torres Strait Islanders present here today. Let's start with the basics. Antibiotic resistance, or AMR, might sound like something out of a sci-fi movie, but it's a very real, very present global health issue. Here's the situation. Bacteria are living organisms, and like all organisms, they adapt. The more we expose them to antibiotics, especially when we misuse or overuse them, the more they evolve ways to survive. So while we think we are wiping them out, they're often just learning how to fight back harder. It's estimated that around 700,000 people die each year globally from resistant infections. If this continues, that number could skyrocket to 10 million by 2050. To put that into perspective, it's more than the current global deaths from cancer. And this just doesn't affect faraway countries, it affects all of us here in our own community in Australia as well. So, why should we be worried? In 2020, five specific bacterial infections alone caused 21,000 antibiotic resistant cases in Australia. Yep, and that led to a financial burden of $72 million. Dollars. And no, that's not a typo. Um, the hospital stays, longer treatment times, specialist consultations, it adds up quickly. And then there's the human cost. People are losing up to 15 years of good quality life due to premature death from resistant infections. These aren't just statistics, they're real people. Your grandparents, your neighbors, even you or me. We can't afford to ignore this problem. All right then, what is the solution? The solution is antimicrobial stewardship, or AMS. This isn't just a mouthful of syllables, it's a really practical and powerful concept. AMS means using antibiotics responsibly, the right drug at the right dose, and at the right time, and only when truly necessary. In aged care, AMS involves getting staff the tools, training, and confidence to ask questions. Do we really need antibiotics for this resistance? It's about putting protocols in place so we don't automatically reach for antibiotics like they're Panadol. It may sound simple, but changing a long established culture takes time and consistent effort. That's where education, leadership, and collaboration came in. So, why the spotlight on aged care? Well, aged care homes are unique. They're medical facilities and people's homes at the same time. Residents are older, often frailer, and more prone to infections due to weaker immune systems. They deserve the best care, not the fastest fix. Shockingly, 70% of aged care residents in Australia receive antibiotics every year, but studies show that only about 1 in 4 prescriptions are really appropriate. That's like flipping a coin to decide on treatment. Worse still, overuse can lead to resistant infections like C. difficile, which can be very dangerous. By focusing on aged care, we are protecting one of our most vulnerable populations and resistance from spreading into the broader community. So, isn't that just easy to develop an AMS in any facility? No, there are some barriers, and let's talk about what's standing in the way of AMS. Firstly, the human side. Staff often operate under immense pressure. They may not have regular training on antibiotic guidelines, and there can be a belief that modern medication equals better care. There's also fear, a fear of missing something serious, fear of blame. It's understandable. Culturally, they're often just in case attitude. Changing this mindset means more than just handing out a fact sheet. It takes mentoring, team discussions, reflection, and confidence building. AMS isn't just about blame, it's about empowerment. Now, let's look at the system barriers. Picture a busy aged care facility with limited access to pharmacies, diagnostic tests, or infectious disease experts. Decisions often fall on staff who are juggling multiple roles. Sometimes doctors are off-site and may not be familiar with residents or facility policies. There are AMS policies at national level, but on the ground, implementing them can feel like trying to plug a leak with sticky tape. We need systems that are both robust and practical, and we need resources that match the expectations being placed on aged care staff. Our team wants to do more than just talk about these problems. We want to understand them. We are launching a national survey of aged care staff and health professionals. We are asking about their experiences, their challenges, their training, and how antibiotic decisions are made day to day. This isn't just number crunching. Yes, we will collect data, but also real stories. Because behind every prescription is a person making a tough call, and behind every resistant infections is someone who paid the price. With this insight, we can shape strategies that are grounded in reality. So, how does this all help the community? For residents, it will create better care and fewer side effects, a safer environment. For staff, more knowledge, more confidence, and clearer pathways for decision making. And for everyone, we strengthen the overall healthcare system. This project is just about building a healthier, safer, and more sustainable future for aged care in Australia. Once we have the results, we won't be sitting on them like a dragon guarding treasure. We will publish in peer-reviewed journals, present at conferences, run webinars and workshops, and create bit-sized, easy-to-read summaries for aged care staff who don't have time to read 20-page reports. Knowledge is power, but only if it's shared. And our goal is to make these findings not only accessible, but also actionable. Because if the knowledge stays locked in academia, we've missed the point. Beyond aged care facilities, we want to engage with policymakers and the public. That means writing policy briefs, participating in consultations, and even sharing insights through community newsletters. The idea is to influence policy from the ground up, led by evidence and powered by lived experience. Because real change comes when science meets practice. So, what's the final takeaway? Antibiotic resistance is real, it's growing, and especially dangerous in aged care. But AMS offers us a path forward. If we are willing to listen, learn, and act, this project isn't just about pointing fingers. It's about supporting staff, protecting residents, and improving systems. It's about using antibiotics wisely so they remain effective for your grandparents, your future self, and the next generation. This is a fight we can win, but it's going to take all of us. Before I wrap up, I would like to acknowledge the key sources that supported this presentation. This includes World Health Organization, APIC, Australian Institute of Health Innovation and Information, as well as peer-reviewed journals of antimicrobial chemotherapy. These references provided the data and insights that helped shape the project, ensuring everything I've shared with you is grounded and credible. If anyone wants to have more read, you can always click on these links or check these databases. Thank you so much for your time and attention today. Let's work together to use antibiotics wisely and safeguard our future. And remember, antibiotics aren't magic bullets, they're precious tools. Let's treat them like it. And hey, next time you get offered antibiotics for a sore throat, maybe just say, thanks, but I'll take my immune system do the heavy lifting today. Thank you.